For everyone, it's very different. For me, it was a personal tragedy that I suffered as a 4-year-old. I had a major accident, and if you can focus on the left side of my cheek, I have a big scar to prove it. And I was in a motorcycle accident where I was a pedestrian. I was hit, and a great deal of time was spent in a hospital recovering from this trauma that I incurred. But you know, just being in that environment at a young age, my mom is a nurse, so I had that influence on me growing up throughout my life. I guess combining with those two aspects of sort of personal experiences as well as my interest in science and math, medicine seemed like a very optimum career, and I pursued it very early on in my career. As early as high school, I decided I should try medicine as a career. At Center Orthopaedics, we'll be performing a plethora of procedures which are both interventional and non-interventional based. We'll be caring for patients with chronic and acute pain needs. Chronic pain not just coming from spine-related disorders, but also emanating from other causes of pain, which include arthritis, fibromyalgia, neuropathic pain, cancer pain, sports-related injuries. We'll be performing procedures anywhere from simple procedures like trigger point injections to as complicated as spinal cord stimulation and kyphoplasties and vertebroplasties. In between, we'll be performing epidural nerve blocks. We'll be performing facet joint injections, radiofrequency treatments, ultrasound-guided nerve blocks. With the advancements in both procedures and non-procedural intervention modalities such as physical therapy and other surgical options, pain management as a field has come a long way, offering its advantages to patients and alleviate their suffering as soon as and as early as possible. One of the most exciting aspects of chronic pain and spine-related pain disorders is the advancements in spinal cord stimulation and radiofrequency. For me, it is very gratifying and satisfying to know that I can help patients in the acute care of their needs. Pain management, as you know, not only affects the physical discomfort of a body, but it also affects their psychosocial and socioeconomic quality of life. Knowing that I can help the patients in that time was very gratifying to me. Plus, there have been so many advancements in recent modern medicine with the pain management field. We're talking procedures that have come a long way. We have non-interventional modalities. If you combine all of them together, patients are usually getting the best outcome. Well, I like to balance things out. I like to design a treatment plan based on the individual patient, what the underlying, what we call medical pathology is. If I see a herniated disc impinging on a nerve root and patient is in severe pain, the best treatment at that time is to go ahead and do an injection to alleviate the pain. But if I see that there's a chronic change in someone's spine or any other joint in the body, and I know that doing an injection is an option but is not the first option, then I like to start in a conservative manner. At TCOA, which is Center Orthopaedic Associates, we're very lucky to have an outstanding physical therapy department. The physical therapy department works very intimately and closely with all the physicians caring for their patients. This also offers a great deal of benefit and convenience for our patients. They're not traveling from one office building to another office building in this busy Northern Virginia traffic. Also, it offers a benefit in a way where we can get their treatment plan started as early as possible. When a patient comes to see me for a consultation visit, before we discuss the procedural options, we like to go over the underlying pathology. This is what the cause of their pain complaint is. After that, we discuss the intervention and non-intervention options. And if the patient decides to do an interventional options, then we get that scheduled at the earliest of their convenience. 99% of our procedures are done in an office-based setting, in an outpatient setting, which means patients come to our office, have the procedure done, and they go home. If, for example, a patient has a severe anxiety or fears related to needles or in procedures, we can also arrange for those to be performed in our surgery center under sedation and with the help of anesthesiologists. My team and I look forward to taking care of you and providing you the best care possible and making your experience as positive as possible.